Okay, let's be real. Parenting is not easy, but you are not alone. Welcome to the Parent Prescription, a podcast where I will give you real, practical advice to help you navigate the ups and the downs of raising healthy, happy children without losing your mind. Welcome back to the Parent Prescription. Today we are pulling back the curtain on what really happens inside the pediatric clinic. Last time we did what happens in the emergency room. Now we're going to let you in on what happens in the clinic. From the pediatrician's perspective, when you come in for a visit, you see the exam room and maybe a 15 or 20-minute appointment. But behind the scenes, there's chart reviews, lab calls, follow-ups, vaccine planning, a lot of care coordination, and a lot of decision making that has to happen in real time. Okay? In this episode, I'll let you know what a typical day looks like and what we're thinking about before you even knock on the door, before you even come in. Okay? And the concerns that we have even after you leave. So my goal is to help you be more informed about what's happening behind the scenes of the pediatric clinic so that we can partner in the care of your child. Let's step behind the exam room doors and get into this dose of Dr. C. Okay. Do you ever wonder what is happening in the clinic? Like, all I did was come in because I think my child has an ear infection. That's it. I just want to see if he has an ear infection, does he need medicine? And I've been here for 35 minutes. Do you ever wonder what else is going on? Okay, so I want to break this down to you so that you can understand what's happening in my world. In all, I'll say pediatricians, I won't use the all doctors, but if you're not a specialist and you're not going in just looking at a bone or at a foot every single visit, then everything in a primary care office, pediatricians, family practice, internal medicine, it's a little bit different, okay? And so the first thing is there's things that we are doing before you even get here, before the doors open, chart reviews. Even the day before, we're having to look at the next day's list. What's coming? What do we need to pull their specialist report from when they saw ENT 2 weeks ago? Or is it somebody coming in for a follow-up hospitalization? Do we need to pull the records? Somebody coming in for a follow-up ER visit, and we need to see what happened at the ER. Yes, sometimes you remember to bring the records. A lot of times you don't remember to bring the records. So we're trying to get that information before you even get here. We're answering telephone notes from the day before. And so the phone calls that happen after lunch, if they were not able to be addressed before we left for that day, we're coming in the morning trying to look at those phone calls before the day even gets started. And so you wonder, hey, I didn't get a call back. The day is going the whole time. So when you call, you may not get a call back in an hour or 2 hours. Matter of fact, you probably won't, because our day is steady with kids in and out of the clinic. And so once you get that phone call in, your goal is to wait so that you do not miss the call, but to hold that phone so that when we do call you back, you're able to answer it so we're not playing phone tag, okay? But these are some of the things that we're doing prior to how many vaccines are we going to need today. These are the things that we're doing prior to you guys even walking through the door, okay? So let's break down the sick visit and the wellness visit. So a lot of people will tell me, Dr. Calloway, I can't even get in to see you. I called and they said it was going to be 3 months down the line. And I'm like, that's for a wellness visit. If you have an appointment that is for a full physical, head-to-toe wellness visit, or some people call it a yearly checkup, okay? That is only, I've got certain slots during the day where that we're checking everything. We're checking the growth. Certain ages, we're having to ask about development. We always ask about school. If we're not in the developmental stages, we're asking about school and how it's going to make sure things are going well. Do we need to do testing for other things if school's not going well? We're definitely making sure that the eating habits are okay and that the growth is okay. Do we need to do labs because the eating habits are bad? That the weight over the past year jumped up too fast and we needed to do blood work to check cholesterol and A1C. Wellness visits are just to make sure we are staying well. Blood pressure check, vision screens, So when you come in for a wellness visit and you think that, well, my kid is well, this should be, easy peasy simple. And then you go, okay, wait a minute. They had to give a urine. Okay. They had to, they listened to the heart rate, and the heart rate was too fast. And so they actually sent me over to the imaging center so that we could get an EKG. I thought this was just a wellness visit. Or when she asked certain questions, my child said in athletics, every time he's running, he's wheezing. And so now we're getting a chest x-ray and an inhaler that we didn't have before. So things come up in a wellness visit. That's why it's important to do your yearly physical. Physicals and wellness visit are equivalent. So your physical, if it's not just for athletics, it's your complete whole wellness, where we're asking you about everything from school and education to your sleep habits and your eating habits to your bowel pattern, everything. So that's why there's only so many wellness visits that can be done in a day. If we did wellness visits all day long, I couldn't get sick kids in, and it would be a very prolonged day. I have to be able to stick sick visits in. So when you say I couldn't get in, but I really wanted to talk to you about the rash, that's not a wellness visit. So go ahead and schedule your wellness visit for 3 months down the line, but go ahead and say, but I wanted to talk to her about the rash that we've been having on and off for the past 3 weeks. Make a visit for that. That is a sick visit, even though your kid is not sick. So I wanted to explain the difference between a wellness or a checkup, yearly physical, and a sick visit. Even if they're not having cough, fever, runny nose, if there's any other concern, their mood, their sleep, a rash, headaches, belly aches, that's not a wellness. That is a sick visit, and they can come in at any time. Okay? So that's the one thing. So your wellness visits may lead to other questions and concerns, but that one is just a full physical. Now on sick visits, when you come in and say, hey, I was just coming in to get my ear checked. You come in and you get checked in, and you're sitting in the waiting room like, oh my goodness, I'm sitting here. What is taking so long? The problem is that you are unsure, or you do not know what is happening behind the door. Behind that waiting room door, there could be all kinds of things going on. So even though it's not an emergency room, what if the person before you had a suicidal attempt or thoughts of suicide? And so the hard part is I can't rush that. I can't say, oh, okay, it was good to see you. I'm sorry you're having suicidal ideation. I'm going to refer you to a counselor. Goodbye. I have other patients that need to be seen for their ear infections. Right? That won't be rushed, at least not here. So if you're somewhere else and they're rushing you out and you have something serious going on like that, that's not a good idea. No, I'm not a counselor, but I do lead with my heart. And I'm going to sit and see if there's things that we can do to help until we can get into the counselor. Does that make sense? And so there are things that are serious, more serious, even though the ear is very important because it makes babies fussy and sometimes have fever and cranky, and they won't sleep well. And that's very serious too. But that checking the ears, you're right. It only takes a few minutes to check the ears. However, if the person before you has ADHD and their medicines are not working, and we're trying to figure out what other medicines they've had in the past and what didn't work and what caused bad reactions, and there are things that we have to talk about to figure out. And sometimes that takes a little bit more time. And so we have to have a little more patience, because in the medical field, everything's not cookie cutter or cut and paste easy. Yes, it's an ear infection. Sure, I'll send antibiotics. I wish we could do it like that and have everybody that had ear pain first thing at 8 o'clock in the morning, and that way you could get in and out. But if you called at 2 o'clock and we got you in, it may take a little bit to get out. Okay? And so I wanted to make sure I made that clear on sick visits. We still have to do vitals. We still have to make sure we have your medication allergies. The nurse still has to ask those questions. We still have to make sure your list of medications are correct. We still have to make sure you haven't had any hospitalizations or surgery since the last time we saw you. So the nurses are asking these questions before every visit. So don't get frustrated with the nurses, you guys. They have to ask those questions, because otherwise we send your paperwork off to somebody, your chart off to, we had to refer you to endocrinology. And on the referral, your chart's not correct because we didn't update your information. And so the frustrations that you may get with, didn't you ask me the last time if I was on that medicine? Oh, yes, ma'am. I'm asking you again to make sure you're still on that medicine. Those, I want you guys to realize the reason we have to do that is to keep our charts up to date. So when you call and you say, I need a refill, we don't say a refill of what? We don't have any medicine in the computer for you, right? It eliminates some things. It eliminates some frustrations. It eliminates some calls, okay? And so that's another thing that happens during the sick visits that we think are going to be quick. I'm going to be in and out. And we have to get those things done first. Paperwork. Sometimes the visits require paperwork. Most of the time that is in a wellness visit. And so you'll get something, maybe an ASQ for the little kids, so that we can go over their communication and their motor skills, and we'll ask you about how they interact with you or interact with others. And so that gives us knowledge or information so we can be thorough. It does take time for you to fill that out, right? For our preteens and teenagers, you get what's called a PHQ-9 or a GAD-7. Those 2 pages for your kid to fill out takes a little bit of time to fill it out, but that's so that we can know, are we having childhood anxiety? Are we having signs of depression? If we don't do those screenings every year when you come in for the wellness visits, we may miss something. You wouldn't believe how many times we've had that screening and we find out something that the parent didn't know. And they're like, I didn't know you felt that way, or I didn't know this was happening at school. And we are able to open that door up of communication so that it gives the parent more insight into the things that their preteens or their teenagers are withholding in. And once the door is open, then we can start to address some things. So paperwork is included in some of these visits. Now, on our sick visits, sometimes even our follow-ups have paperwork. And so when you're talking about a concussion, or a concussion follow-up from the ER, you go, oh, we're not having any of those symptoms or signs anymore, so this should be easy peasy and good. It usually is, but I still have to document the symptoms that we did have and the symptoms that we're having now to know, can you go back to full activity in athletics? So these are the things. I just want you to know that there are thought processes that are happening and things that have to be documented, not only legally, but so that we can be thorough in your kids' health, okay? And so, yes, sometimes we have to do paperwork. Sometimes it takes a little bit to fill those things out. And you want to, of course, get in and out of the office so you can get back to work and they can get back to school. But sometimes those things have to be done, okay? There are times that it doesn't, but sometimes they do, okay? So have patience with me or whatever provider you see. When the nurse comes in and say, hey, I need you to fill this out, that's something that I need you to do. And I'm going to backtrack on the vaccines, on the wellness visits that are getting vaccinations. Now it has become a little bit of a longer issue or thing now, because not only are we giving them the information of what vaccines they're getting, these have become prolonged conversations just because of what's going on with social media right now. And so a lot of time is spent because I'm answering questions that people have about each specific vaccination. And I'm not going to dismiss it because we want the kid to be healthy and to be able to get their vaccines. So if I dismiss it, it may keep somebody from getting them, when if they get the information, they'll go ahead and do what's needed for the child. And so these visits take a little bit longer now because now people are saying, hey, I'm nervous about all the information that's coming out on social media. And Doc, what do you think? Well, give me more information. And we're going through those things when normally back, previous to the concerns that have been presented, we would just give them the paper and say, hey, here's the information of what you're getting. This is what you need to sign, and we'll be right back in. So there is some insight that I wanted to make sure you knew about your visits. I had someone recently say, oh my goodness, I've never before I walked in. I've never waited this long in a doctor's office before. They had got there about 15 minutes early, and they had been waiting for about 35 minutes, and said, I never waited this long. By the time they left, their comment was, "You're the most thorough doctor I've ever been to." Well, you can't have it both ways, okay? So there may be a wait when you go to the doctor's office of a thorough doctor, but you also will be able to be heard and voice your concerns and be able to get a full understanding of what's going on, okay? And so those are the things that we really just want you to know, especially when it comes to pediatrics, because most people in pediatrics are doing it because of their love for it, their love for kids, their love to see kids healthy and growing and achieving in school and sports and, making sure that they're doing well in life. But sometimes that takes time, having to get them to open up to you, making the parents step out for a minute so that they can address some things because they saw the face of the patient and they said, you know what, I'm going to get mom and dad to step out so that you can be truly open, and then we can talk to mom and dad together. That takes time, guys. And so true pediatric offices, sometimes you're going to be in and out. Great, you got in a good time. There had been nothing that was serious during the day, and so you were able to get in and out. And sometimes it's just a day where there have been multiple, like a transfer, ER transfer. I had to call the ambulance and had to wait until they picked somebody up and explain to the people that got there what was going on in room 2. And so room 3 and 4 were waiting because I had to wait on the ambulance to get there. Or I had to go and talk to one of the other doctors that called about a patient that was serious that was in the hospital. And they wanted to give me information so that I could take good care of them once they got discharged from the hospital. All of these things are going on at the same time. Medicines are being sent, labs are being ordered. These things are happening behind the scenes. And so knowing that, having the knowledge of what's going on should help you to understand and maybe give us a little bit of grace, not just us, whoever you see, a little bit of grace when you feel like things are going a little bit longer than they should in a setting where you're just coming in for something that you think is quick. A couple of more things just so you can know the process. So referrals and phone calls, that's always a big thing. People will call, let's just give an example. People will call and say, hey, can I send some pictures? I've got this, this eye that I think it's pink eye, but I don't know if it's allergies. I really can't come in, but can I send a picture? And they'll call at 10 o'clock in the morning. And they will call back at 11:50 right before lunch and say, nobody's called me back yet. That's because as the day is progressing, that call has not been addressed yet. The nurse hasn't been able to pull me to the side to say, hey, take a peek at this picture, doc. Hasn't been able to pull me to the side to say, what do you want me to tell this patient? So because you called in the morning, you should be able to get a response in the afternoon, because that morning we still have patient after patient after patient, and the nurses are trying to figure out when's a good time to pull me to ask me those questions. A lot of those calls are getting addressed either during my lunch break, right? Or at the very end of my day. Once all the patients are gone, we try to have a good 30-minute window where I can send phone notes back to the nurses and say, hey, this is what you need to tell them. This is what you need to tell them. Hey, I'm going to send this one a medicine. And they're trying to give those calls back so that if you feel like you're waiting a little bit, but you're calling every hour or two trying to get a response, it doesn't rush the process. You would think, well, maybe they forgot about me. If it hasn't been 24 hours, you weren't forgotten about. So I'm trying to save you some frustration and some time so that you don't feel like we forgot about you, okay? And if you go, but it's an emergency, that's when you ask, when you call, is this something I need to go to the emergency room for? Or can I speak to the nurse to see if I need to go to the emergency room, or if this is something that they can address in-house, okay? So that's one thing. The referrals. Referrals are going to take time, just a little bit. I think we've got a better routine now, but the nurse has to sit down, collect the information, make sure it's all in the chart, and refer it over. It goes through the insurance company, then they send it to the other provider, and they usually contact you back with a date and a time. So the cardiologist will call you and say, we got your referral. It may take them 2 weeks to get it, or to go through their faxes. We got your referral. Can you come in on February the 28th at 2 p.m. and you talk to the specialist? So calling, multiple times to see, hey, has the referral been sent? I get it. If it's been 2 weeks and you go, I hadn't heard anything, definitely call and say, hey, I haven't heard anything, and we can tell you where we sent the referral, and maybe you can call them and ask them, what does the time frame look like? But as far as just repetitive calling, it doesn't help the process at all. I'm not being rude, I promise. I just want you to know what's happening on this end, okay? Lastly, we want to join in with the parent. The pediatrician and the parents are a team to help take care of your kids from newborn baby all the way up until they're 21 or 18, depending on the pediatrician. We just want to be a joint heir or a joint partner with you on taking care of your children. Okay, so you have to come and be upfront about things, your concerns, the medicines that we're taking, the supplements that we're giving. Make sure you've got facts or knowledge about what's going on or what's happening. If you've got to put it in your phone or write it down so that we can have all of the information, that would be helpful. But let's do it together as a team, because then it makes it a little more, just makes it better. It makes it easier. It becomes, we become like family, okay? And so I want you guys to know the other side of what's happening in the family, so that you don't have some of the frustrations that you may have wherever you are going. But especially for my patients that are watching this, I wanted you to be able to notice the difference between the wellness visits, the sick visits, the time frame, what's happening with calls, what's happening with send outs and referrals, and what is going on during our day. I hope that was helpful. I really, really do. I know that wasn't a typical, information about a specific illness or what to do in the case of something that's happening in your child's body, but I wanted you to know what was happening in your child's clinic. Okay? So I love my patients. I love what I do. I love my families. I appreciate you for letting me take care of your kids. Hey, share this. Join in on the socials that we have. We've got TikTok more so for fun, but we have TikTok, and we are giving out some information once a week on there. We've got now this YouTube podcast, and we also have the Facebook page that we give out daily information if you need to know about the clinic. Join in on those things. Share these things, especially if you feel like it's a topic that you think people need to know about. But don't hesitate to give this information out. That's the whole point of it, is free knowledge, free information. Share it. Don't keep it. That's selfish.